Care and Treatment Reviews, CTRs, and Care and Education Treatment Reviews, CETRs, are part of NHS England's plan to make people's care better by stopping unnecessary admissions to hospital and reducing time spent in specialised hospitals. Care and Treatment Reviews, CTRs, are for adults who have learning disabilities, autism, or both. Care, Education and Treatment Reviews, CETRs, are for children or young people under the age of 18 who have learning disabilities, autism, or both. In this video we are focusing on CTRs for adults. They are not for people with a physical illness or injury who may need to go into an acute hospital. CTRs focus on 4 big questions. Are people safe in receiving good quality care in the most appropriate place? People's views are taken into consideration and they are engaged with around their care and treatment plans. Does this person need to be in hospital for planned treatment, and is this the only place that this can happen? Are there plans for discharge in place and agreed? The Clinical Commissioning Group, CCG, organises CTRs, which includes a panel of members. The chair should be the Health Commissioner, also a clinical reviewer and an expert by experience, both of which are independent panel members. The panel meets the person, their family and other key professionals involved in the person's care. Hospital CTRs take place every 6 months, focused around the 4 big questions. Community CTRs take place when professionals are concerned about the health and well-being of a person. This may result in care and support being wrapped around a person in the community to prevent the person from going into hospital unnecessarily and to support them during difficult times within their life. For both inpatient and community CTRs, meetings are usually held in person, face-to-face. Unfortunately, due to the COVID-19 pandemic and restrictions put in place to keep people safe, CTRs are now being held virtually. The meetings now take place on something called Microsoft Teams. This is a computer application that allows people to use their computers to see and talk to others on the internet. Once the pandemic is over, we will review how best to carry on these meetings, and if the person whose CTR prefers this reasonable adjustment can be made, but the panel will physically visit the ward. The meeting has the same format whether it takes place in hospital, in the community, or virtually. Before the CTR, the panel review the care and treatment plans. The panel will meet the person, their family, and advocate to discuss their experience. During the CTR, the meeting is chaired by the Health Commissioner. The panel listens to all professionals involved in the person's care and treatment. The panel focuses on the 4 big questions and will engage with the professionals to make sure that the person is safe and well. During a recess, the panel will discuss their findings and will make key recommendations. The panel feeds back their findings and recommendations, which can include areas of good practice or key improvement actions to be completed by the agreed deadline. After the CTR, the action plan is shared with everybody who attended, informing them of their actions and when these need to be completed. In Sunderland, the action plan is shared and updated every month and fed through to the Health Commissioner. This allows any actions outstanding to be picked by the Health Commissioner and escalated appropriately.